Only need sunscreen in summer? Think again. Hi, I'm Jo Lemieux, and I'm a nurse dermoscopist with Skin Institute, and today I'm here to dispel some myths about skin cancer and sun protection here in New Zealand. So one of the things that a lot of people come in as a misnomer is that only fair-skinned people have skin cancer or get skin cancers. This is completely false. Anyone in New Zealand can get skin cancer, and we see it every day. It doesn't matter what color your skin is. It doesn't matter if you tan easily. You are at risk of skin cancer. Windows do not provide any kind of sun protection unless you've actually paid for a specialized UVA, UVB film to be put on your window. You're getting UV radiation the whole time you're at work unless you've got a blind that you can put down that actually protects you. So both of those factors, even though that person isn't actually going outside for lengthy amounts of time, they're actually exposed for that whole entire day. One of the issues that we see with our patients is that sometimes they're only coming in when they think there is a problem, and it may not be a problem, and it may be a problem. But the best way to get around that is to have your skin checked regularly by someone who's trained to do so. And that way we're catching stuff early, or we're just giving you a really good peace of mind in knowing that actually everything's okay. Another misconception is that skin checks take a really, really long time, that you're going to be naked in front of someone. Actually, it's a really comfortable situation. Your provider is going to make you feel comfortable. You're going to create a relationship with them. You're going to get talking. It's actually just having a big yarn with someone while they're checking your skin. We have a quick conversation about your history, which is really just finding out about you, about your sun exposure, about your UV exposure from the past all the way to today, and we talk about your habits. Skin check is really, really all-encompassing, and it should be with whoever you go and see to do your skin check. So that is your whole body, and your skin covers your entire body. So that means we're looking through your hair and at your scalp, regardless of how much hair you have. There's two different kinds of sunscreen. We have mineral sunscreen and chemical sunscreen, and they both have very effective uses, and they're good in conjunction together. However, we have to know which is more appropriate to use when. So I often tell my patients, use a chemical-based sunscreen first thing in the morning, and that's because it absorbs into the layers of the skin, whereas a mineral sunscreen is a very topical sunscreen. So zinc is really, really great. Most of them are zinc-based because it's got reflective properties. So you slap it on and it reflects the sun straight away. However, if you're wearing a purse or a shirt or something and it's rubbing, it will rub it off entirely. Start with a chemical-based sunscreen, and then if you start feeling like you're getting a hot spot, then in place of that spot, you can grab your zinc-based sunscreen, you can slap it on that spot, immediate relief from the sun, bouncing off those UV rays, and you're not going to get a sunburn in that spot. And then throughout the day, just keep that process going. Protecting your skin doesn't need to be complicated. It just needs to be consistent. 365 days a year, all day, every day. Make your yearly skin check part of your health routine. You can book at skininstitute.co.nz because prevention really is the best protection.